My name is Iain Cranston. I'm a diabetes physician based in Portsmouth on the south coast.
Fantastic.
And my name is Partha. I'm a consultant also based in Portsmouth, working with Iain Cranston.
And you're also,
I'm also the National Specialty Advisor for Diabetes with NHS England.
you've both just done a session together. What was that all about?
So it's about technology and diabetes care, and I guess the double act is he's the big picture and the principles, and I'm the nuts and bolts person in the conversation.
So what sort of things were you looking at in that session?
So I think, what the main thing is, so I've got a fundamental philosophy. Science is only good if you put it into people's lives. And I think, but the first step is to get the science right. So Iain mostly talked about the science, and my bit was more about how do you then get the science to go through all the policy and the money and the variation and all that to get it into people's lives. That's pretty much what it was about.
But you've done an amazing job, haven't you?
Well, it depends as to how you look at it. I mean, I personally would say that it's also the job, and it takes time, energy, and I've had some fantastic allies along the way. So, but yeah, thank you for that. But no, it is also the job.
It is, but you've also championed and you've said to people you can get in touch with me. So you've been very approachable in that national role, haven't you?
I think my leadership style has always been, and we're talking with me and Iain, and Iain has known me for a number of years, even when I was a trainee. That's always been my style. It's as I call it, very heavy metal. It's like always 100 miles an hour. And I genuinely have seen, and this is what I do pass on to people, is that the strength, if you want to implement something, is with the people with diabetes. So if you get them on your side and they're backing you, most policy spaces will bend to that. And that's pretty much what's happened.
So on the tech side, what's kind of there now that is very, very clever? Can we talk about the...
So I think my outlook on tech is there for one of two reasons. It's either there to do something better than we can do it ourselves, or to do it in a way that makes it easier for us to do it ourselves. So I always use the example of the washing machine. The washing machine actually doesn't wash your clothes any better than you can, but it does it much more simply. And I think the real change that we've seen in medical technology generally, but particularly diabetes technology in the last 5 to 10 years, has been, rather than concentrating solely on the outcome and the effectiveness, it absolutely started looking at the usability and how people can access it more easily. That said, with all technology, there is a how do I use it best? And I think that's kind of where we are at the moment, because obviously much of the technology that we're talking about, and I guess mainly what we've been talking about today, has been around CGM, insulin pumps and hybrid closed loops, although obviously there are other technologies out there that are important as well. But I think the utility of those is largely driven by how people use their mobile phones. And so we're in this interesting position at the moment, which is medical technology and personal technology requires each other to work well. And I think that the truism is that most of us don't really understand how our mobile phones work. So I think largely there is a piece about get good with your mobile phone, because then you'll be able to work with technology really well on any level.
Is that amount of data going to be useful that's coming in then from people using their mobile phones at some point in the future? There's a mass amount of data.
So certainly the world that we live in at the moment is built upon the principle that data is power, isn't it, I think? So I think realistically big data clearly can be important. On a much more practical level, I think that data is very important on an individual perspective, because what has happened and what will happen in the future are very closely related one to the other. So if you keep doing the same thing that you did last week, you'll keep getting the same results you got last week. So if you want to do something different, it's working out where a change can happen. And sometimes those changes that can be made are tiny, but the impact of the changes can be huge.
So an event like this, Partha, why is it so important to bring people together in these sort of conference events?
So I always have said that chronic disease, any chronic disease, and in this context, let's say diabetes, the three planks on which it sits is self-management, peer support, and access to trained professionals. And this conference, brings all those three together, right? People talk about how are you managing your diabetes better? You're talking to other people who are managing it, and you've got a lot of trained professionals around. So it's a beautiful sort of microcosm of what care should be about. And you're getting people in one place, people are talking about it, the old school hierarchy is not there. So that's good, and I think that's what it brings to the party, so to speak.
Have either of you got some top tips to share with us today?
So from my point of view, I think it depends as to who it's aimed at, but from my point of view, to anybody with diabetes, I would say the change is here, and don't be afraid to ask for what you are eligible for. And I think people always get a bit worried about how much they can ask. There's lots of professionals like us who are trying to make the system better, but you have a louder voice than you think, and I think I would say ask. You're not asking for things which are not authorized, they are. So do that, and the system then will change according to your ask.
So I've got a different type of one which you might expect, which is technology isn't magic. It is often very clever, but it's not magic, and it works best when we as individuals know what we want from the technology. So none of the technology that stands at present takes the diabetes away, but it can help, but different technologies can help in different circumstances. So I think the first clear piece for an individual is what is it that I want to be different and how would I like that to be changed has to be the starting point for all technology discussions.